A very good morning to all. Today our lecture topic is antimanic agents. I am a Role Selvam Assistant Professor in Department of Pharmacology, Station College of Pharmacy. Antimanic drugs. So, what is mania? So, mania is a mental illness or bipolar disorder. Is called as a bipolar disorder. The drug to use for the mania patients are called as antimanic drugs. Antimanic drugs are the drugs to use to control the mood swing. So many of the people's to contain a mood swing nowadays. Many of the people's contain a mood swing that occurs during a manic depression, depressive illness. That's called as a bipolar disorder. Bipolar disorder is formally called as a manic depression in a mental health condition that causes a extreme mood swing that include emotional highs and mania and lows of the depressions. Our mood swings that has a very include or emotional is very high. Its condition is called as a mania. So our emotional mood swing is a very low. It's called as a depression. So mania is one of the bipolar disorder. When you become depressed, you feel a very sad and or hopeless and loss of interest or pressure in most of the activities. When your mood shift to the mania, you feel euphoric or full of energy or unusually irritable. These mood swings can affect the sleep, energy, and activity judgments, and behaviors, and the ability to think clearly. So commonly used anti-maniac drugs. So that there are so many drugs are used for the maniac patients. So they're very commonly used for our drugs for the lithium carbonate. It's a very one of the inorganic agents, and many of the anti-epileptic drugs are used for the anti-mania drugs. Drug example for that anti-epileptic drugs are carbamazepine, valproate, and lamotrigine. It's drugs used to mainly treat for the anti-epileptic, but it is used for the anti-manic drugs also. Some of the antipsychotic drugs are used to anti-manic agents like olanzapine and risperidone and carbamazepines and carfenrazine. Some of the drugs used to the anti-manic drugs. Mainly used for the drugs for inorganic agents is like called as a lithium. So what are the lithium? Lithium is a very common drugs used to the produce antimania patient. Lithium is produce excitatory action in dopamine and glutamate and inhibitory action in the GABA. So that our lithium involved in the uh, inositol pathway. In that lithiums to inhibit the inositol monophosphates and other important enzymes in that normal recycling of the membrane phosphorescence. In that phosphoinositol conversion in IP IP22 IP2 is nothing but the inositol diphosphate to inositol monophosphate conversion. In that enzymes involved in inositol monophosphatase. So that our drugs to inhibit the inositol monophosphatase, so that to produce the um, conversion will be stopped, so that the many the depressions or hallucinations to be decreased. So that what are the therapeutic uses of the lithium? There is a very common therapeutic use for the manic depression and schizophrenia. So lithium is known as a very mood stabilizer to the prevent both mania and depression. Schizophrenia, lithium is used to the combination with the neuroleptic with in schizophrenia and endogenous depression is also called used for the patient with the depression. Impulse control disorders and aggressions. Lithium is used to the inhibit the episodic the anger and violence are occurring in the mentally disturbed patients. Lithium can regulate the alcoholisms, irregular alterations of behavior in persons with personality disorder. So lithium is a very common drug to use to the personal behavior and personality disorder patients. In that, the drugs to prevent both mania and depressions also. The very common neuroleptic drugs in that schizophrenia, the lithium is a very combination with it drug for the user in schizophrenia. So many majorly very common side effects are there. So what are the adverse effect? Mild to moderate adverse effect. The very moderate effect is nausea, vomiting and abdominal pain, thrust or muscle weakness and fatigue. Um, Edema is occur. Moderate to severe side effects is a blood division. Some of the patients to blood division, confusion, convulsions, and delirium stages. The severe toxicity to produce the generalized epilepsy. The drugs to severely to act the toxicity parameters is called as a generalized epilepsy and renal failure and gamma or coma or death. So lithium and pregnancy. So lithium is if administered during a last month of pregnancy, lithium toxicity occurs in newborn babies. There's a cyanosis or tremor, hematogaly, and lithium is excreted in the milk of mother, which can also lead to similar toxicity in breast feed babies. So what are the drug interactions? There are so many drug interactions are occurred. Lithium with plus diuretics to reduce the renal clearance of lithium, and lithium is using with NaCls reduce the renal clearance and increase the serum concentration of lithium. And lithium with neuroleptic drugs to produce the neuroleptic toxicity, and lithium with carbamazepine increase the carbamazepine toxicity. So that in that video we are using what is mania, what are the drugs used for the mania, and what are the class of drugs used for the mania, and mechanism involved that lithium carbonate. So what are the adverse effect, what are the therapeutic uses and drug interactions are used in the many patient. So that thank you.